Dr. Roy Picard, DC with Michigan Integrative Health, and this video is going to be about bracing for your knee. Now, so the first thing I want you to do is understand that when we talk about braces, we need to make sure you understand there are different types of braces that are available for the knee. So this first one is actually not really even a brace, it's a sleeve. And this can help similar to having someone tape your knee. Taping a knee or using a sleeve can be helpful for additional support. People with just a minimal degree of strain sprain will often appreciate this extra support with something like this. Many athletes even will get involved in taping and using sleeves on a regular basis. These are pretty common when somebody feels it's necessary that they must, or let's say have to get around, perhaps get through a day of work or even a special event. Then we get into these different types of braces where they are going to offer much more support than the sleeve. These braces actually can be used for different purposes. Many of these need to be custom fitted for an individual. Most of the better ones will have a difference between right and left knee. One of the better braces we will periodically consider will be a hinged brace. The hinges can be made out of plastic or metal. There are single and then there's double hinged braces. Now, here's a brace that is helpful for someone who needs much more support. Perhaps they have some severe tissue damage, maybe a torn meniscus, severe ligament damage to the point where the knee has very little stability at all. After surgery, there will be those who use this type of brace to minimize further tissue damage. And then the last one I want to make you aware of is this style of brace, where it can offer support, specifically though for those who are bone on bone and want to create less pressure on that area. These are referred to as unloading braces. Since we do see many people that are bone on bone, sometimes this might be recommended after receiving our care for a short period of time, just to keep the person comfortable and allow the products we use to maximize healing and repairing in that area. I will tell you, however, that as much as they try and make these braces adaptable to all shapes and sizes of people, it can be a problem for a lot of people, especially if you are extremely overweight and not very tall. If you're of average build or slightly overweight, these braces are normally not a problem to get them to fit correctly and properly. But when it comes to these braces, it's also important that you have the right one with the right fit to offer the necessary degree of stability in order to minimize your pain, while of course you are taking the necessary steps to understand and resolve the cause of your pain. I hope you now understand that not all knee braces are the same. And on behalf of Michigan Integrative Health, I wish you the very best.